So with purple drink, also called Lane, being on the rise in general, I thought it'd be a good video to discuss today. So first and foremost, what's in, and I'm just going to say lean or purple drink because that's what it's typically referred to. So the main ingredient in it is an opioid, which is right here, codeine. Typically what's in, so what we have is the components, contains cough syrup, soda, typically a hard candy you drop into it, and occasionally alcohol, which will increase the effects of drowsiness, dizziness, etc. And also with it, so codeine, and then another big ingredient, and it's not always in it, but it can be, is promethazine as well. Now, promethazine in general really decreases nausea, allergies, and motion sickness. And it's also an antihistamine. So I want to give a little background on this before we go into some of the remedies, but the big thing is a lot of people who are using this, a lot of people are also have a polysubstance issues with it, where they'll add things with it. Interestingly enough, something that's put in it a lot that increases even more dizziness, tiredness, and just amplifies the effect of it, because once again, purple drink or codeine is a downer, has an opioid effect, is melatonin, which melatonin adding in there can be very dangerous because melatonin in itself is something you use for sleep. So if you add that to it, sometimes at first it gives people, they have rebound energy. They'll take some melatonin with their purple drink. They'll have some energy. Like, man, I need a little bit more of it to get that downer effect. And then from there, before you know it, they've mixed melatonin with it, possibly alcohol, and then the mix of all of them together with the codeine can lead to respiratory depression. Now, side effects, real quick. Number one biggest thing, constipation. Constipation, being an opioid, is one of the biggest side effects. Also, slow reflexes, and this is once again because it's a downer. I'm just going to go ahead and say this, it's addictive if used too much of, obviously, which will increase your tolerance. High chance of seizures if you're continuing to use it, and also if you're using things such as alcohol, which if you take that away quickly and you don't taper off of it, if you stop abruptly, can cause seizures. Respiratory depression, so this is kind of the toxicity idea that I'm talking about. Respiratory depression, you have an increased chance, being a downer, and slow heart rate as well. Really, real quick as well, as I stated, the main component, if you're wondering, is codeine, which is an opioid in it. And as well, and why I'm going over this aspect again, is just because being a downer in general, somebody who's using downers a lot of times, even things, once again, such as alcohol, benzos, you name it, when you add those all together, that just amplifies the effects of codeine and even promethazine. Now, real quick, as well with the detox, again, I'm going to re-emphasize this, GI disturbances. Serious stomach cramps when you're detoxing, and to the point of where you've been so backed up for so long that it can lead to things such as explosive diarrhea, and you can actually have some GI and intestinal bleeding from this. Again, potential seizures, people mix alcohol with it, hot and cold sweats is part of the detox as well, really bad flu-like symptoms, muscle twitching all over your body, and that's more on the physical side. On the mental side, those mental cravings, that anxiety, depression, and just generalized mental cravings. So a lot of times when somebody's detoxing, they start in the physical detox, which can be dangerous in its own. But the mental can be that post-acute withdrawal from it. And a lot of times with things like this, obviously it's a problem to where you should be just stopping this all at once, obviously, but obviously talk to doctors about this if you need some sort of substitute or whatnot to get through it. But ideally, like, I know there have been some common mechanisms of how people have tried to taper it, but in general, if you're getting it off of the streets and whatnot, that's probably not a good idea, obviously. But in theory, a taper off something like this, in theory at least, tapering could make it a little bit easier to where your body would adjust a little bit easier to where when you're gradually pulling the substance away, when you're gradually taking it away, it can make it easier long term, and in particular for those mental cravings as well long term. Because sometimes the thing is, depending on how long you've been using it, that can be there for quite a while, 6 months to a year even, and even later, just depending on how much you've been using. But it will get better, no worries. Now, big thing. Oh, real quick as well, I want to touch on the GI disturbances. Remember, being an opioid, constipation, severe constipation, and probably over time you don't even realize how constipated you were from it until when you stop, you realize just how bad it was. A lot of people get a distended stomach, and that's what kind of with the thumbnail that I have there, being on the toilet in a lot of pain, because even if you haven't stopped, hard to go to the bathroom door, you're having bad abdominal distension, which, you know, it's kind of like a protrusion of the stomach, but also with it can be the opposite when you're detoxing, having that diarrhea, explosive diarrhea, and those muscle cramps as well, causing a lot of pain, which once again can cause things such as GI bleeds if used too much of. So this isn't something you want to play with in regards to the detox, and this is why you should be trying to quit, because even, once again, a lot of times people are, it's a polysubstance problem, a lot of times where you're using other things with it, so you're adding those, detoxing with that as well. So when you're detoxing, let's just say you're adding something like alcohol, and you've been using that with it daily, you also, when you're detoxing, would have a chance of seizures, things like this, delusions, and we're going to do the next video over delirium tremens as stated, which you could have more, you could even have a psychotic episode as well when detoxing off of this. Now, the remedies, once again, always try to go to a healthcare provider if you can. That's number one, if you can, but you know, it can be super expensive. People don't have insurance as well, and they're wanting to stop, but they're scared. There are some over-the-counter remedies that can assist with it. It won't, I'm not saying it's going to treat or anything, obviously, but it can assist in this way. So, first and foremost, when you start, especially the physical detox at first, I'm just going to be honest, sometimes you just got to give your body, if you can, 3 to 5 days to where you're just going to be sleeping. You're not getting out of bed. You're going to feel like you have flu-like symptoms. You're going to be on the toilet. It's not going to be pleasant. Try to tell someone if you can. But once you get past that, the trick is a lot of times people can get past, surprisingly, the physical withdrawals, but once they hit that mental aspect, that's when it becomes a problem. So once you get past that, if you can, some people right away, just to increase circulation and blood flow, sleep, and then light exercise. And what I mean by light exercise is, once again, just getting that cardiovascular system going. Walking, light jogging if you can, and you're going to realize a lot of times people have had a lot of weight gain from using. You'll probably notice even in your face and in particular stomach. You'll notice that you had a lot of distension in prior, or even just I'll just say this to make it easier. Feel like you had a couple extra pounds in the stomach, if you know what I mean. But like if you look back at pictures and then you're like, wow, okay, you feel like you're looking better. Powerade for the electrolytes, and these are things just in common, just to know. And I know it's super simple, and you might go, is this really it? No, but these are things that can really just assist in that initial part and the mental part, because hydration is big. Because a lot of times especially when you're going through that detox, and if you're having diarrhea and whatnot, and even when you're using, a lot of times you're not getting a lot of nutrients as it is, your electrolytes can be off, which can cause things such as cardiac dysrhythmias, not getting enough potassium in, things such as magnesium as well. Bland foods, crackers. I wouldn't really recommend fruits and stuff at first. That could cause further GI disturbances, but once you get past that physical aspect of it, those flu-like symptoms, fruits in there, simple carbohydrates in that way, but crackers, protein if you can hold it down, because a lot of times muscle growth has been inhibited during this time when using it. So you'll want to get back to building muscle, which will only help with confidence as well when you're past the physical withdrawal into the mental withdrawal. Nausea meds, which is key. Remember, not only just diarrhea, nausea and vomiting from those flu-like symptoms and that dizziness and vertigo is going to be there. A lot of times in the psychiatric setting, when you're treating it, they use things such as Zofran, which over the counter, they've got Dramamine, which is essentially kind of the same thing. And even ironically, as we stated right here, what people mix with it, a treatment can be, if you're not holding anything down, Promethazine. Now that would be, once again, in the psych setting. Don't you love my writing right here? Horrible. But that's something promethazine can actually help. So obviously tell your provider if you were mixing it, because, you know, even if you were mixing it, because that's a prescription med, it can still be used when you're detoxing, just depending on the circumstances. And also it can help you sleep as well during the detox. Now, as well, as I stated, Zofran's not over-the-counter, it's prescription as well, but they do have an over-the-counter remedy, which you can buy even like a 4 to 8 pack of. You don't have to buy a full bottle of, but I'm telling you that can go a long way in regards to the detox, which you might have more success with. Now, in the psych setting, a lot of times if you've used it for a long time, to get you kicked off, Suboxone or buprenorphine, methadone. However, today methadone, it's still used, but it's not near as common. It's something where you typically have to go every day to the clinic to go get methadone as it is. And it has been shown to be a little bit more, it saves lives, but a little bit more addictive. And a lot of times it's sought after a lot more on the streets even. But Suboxone and methadone are used a lot, but Suboxone in particular because it's hard to overdose on that alone. So that's an option as well. However, once again, a lot of times if you're not in the psychiatric setting, you can't get Suboxone. It'd be illegal, obviously, to get. So Suboxone wouldn't really be a treatment unless you're in the hospital. And that's why I advise, if you can, even if it costs a lot of money, sometimes that's what you have to do to get clean, is go there and you might try out Suboxone. Now, as well, anxiety meds can be used as well in the psych setting, but if you've had problems with addiction, depending on if you've been using things with the codeine syrup, let's say you've been mixing it with alcohol, they will put you on typically a benzo taper of typically something like Ativan. They'll put you on a taper. They'll start you like on a 2 milligram dose, and they'll drop it over like 5 to 6 days to help and assist to make sure you don't have any seizures, as well as assisting as well with sleep. But it's not primarily used for sleep, but it'll help. It'll help a lot of times with those, even sometimes with cravings as well. But in particular, anxiety, and prevent seizures is the biggest thing if you've had alcohol, if you've been drinking alcohol with it, which we'll talk about a little bit more as well when we do the video over psychosis and delirium tremors and how it kind of all connects with each other with the downers, how delirium tremens is kind of like, it's technically a term for alcohol withdrawal or severe alcohol withdrawal, but psychosis in general can happen from a lot of different drugs being used if you stop abruptly as well. Blood pressure meds, Codeine is something that is used for high blood pressure, can be used because sometimes your blood pressure can inadvertently go up super high when you're detoxing off of this, which can cause things potentially such as strokes. Now that won't happen often, but if you've been using a lot, obviously that can happen. So Codeine is a prescription med as well that might be used. And as I stated, long-term medication, Suboxone, SSRIs, SSNRIs, which we have a video on, anxiety meds, but really the big thing too is the remedies. The thing is, there's nothing that's going to completely treat, there's nothing that's just going to, oh, this natural remedy is going to help. They're over-the-counter things such as some herbal teas and whatnot that can help you. You got to be really careful about some of those because some of them can actually cause, not all of them, but there are some, like for example, if you're taking Suboxone, there are things such as like St. John's wort and whatnot that can actually be very dangerous for you. But using like even some green teas and whatnot like that, hot teas, cold teas, can help. Obviously you want to have support. But one key thing that I will tell you from what I've seen that helps people a lot for a natural remedy is surprisingly not only Powerade or Bland Foods or even protein, but vitamin B12. Now not just vitamin B12, but your B vitamins in general, because your energy has been your energy levels have been so depleted that your vitamin B is down to where a lot of times, that's why it's good to get a lab set done. Obviously, if you can't afford it or whatnot, this would be something you could maybe trying a B complex vitamin. And you might find, not at first, once you get past the physical withdrawal and you can hold it down, you can find that can help and assist you with exercise as well, and having a little bit of caffeine as well with it. Not overdoing caffeine at first during the detox, well, during the physical detox, because you might not be able to hold it down, but also caffeine kind of works as a diuretic as well, to where if you're using too much caffeine, that can cause dizziness on its own. So you want to be careful with the caffeine, but when you can start holding fluids down and whatnot, and you've drank water, Powerade, Gatorade, changing over a little bit to a B vitamin or a B complex with a multivitamin even, but with, in general, a little bit of caffeine. And even if you don't want to drink a whole thing like some of those caffeine pills, they really can help. Also, sometimes your creatinine can be low, and sometimes there are some energy drinks that can assist sometimes where you get all of them. There's these things called Bang energy drinks that have been known to somewhat help people when they've gotten past the initial part of the detox, surprisingly. And also those can give you natural rushes of dopamine, because your brain chemicals a lot of times will feel completely depleted when you're detoxing off of this. What a lot of patients have said, to where they start drinking way too much caffeine to where they're getting dehydrated. So that's where the recommendation sometimes of not like a Monster, but like something like a Bang energy drink even, is what I've seen. And I even, for I'll just say this, I don't, like for pre-workouts and stuff, for me to date, that's something that I'll use like a Bang energy drink, because even just before workouts in general, something like that, it feels more natural. And there's not a come down from that kind of energy drink, because I can't drink Monster drinks or whatnot. It gives me way too much energy and I feel very dizzy and whatnot. So this would be something to look into, whether you're withdrawing from something or not. But Bang energy drinks sometimes have been known to help, which is because it has some creatine in it, but that's why you'd want to make sure your kidneys are okay first as well, before you just jump into this. That's why it's good getting a lab set. But if you can't, once you get past that physical withdrawal, it might be something to try. Now, the next video will be covering delirium tremens in regards to alcohol, but we're going to be discussing other downers with it as well. That is your daily dose of mental health. Like and subscribe to the channel. Leave a comment for any questions. I love you all. Thank you to all the new subscribers out there. Have a great week. Keep balling.